Hello, Daniel. My name is Vanessa, and I'm a social worker here at the Kaiser Psychiatric Facility. I appreciate you taking the time to meet me. I was referred to you by your psychiatrist here, who informed me that you were diagnosed with major depressive disorder, as you are already aware. So my understanding is that you are 28 years old and that you have been struggling with depressive symptoms for a while, and that you were admitted to this facility last night for attempting suicide, correct? Okay, well, my role as a social worker here is to create a treatment plan with you in order to help you manage your symptoms related to your depression. I understand that you have some questions and concerns related to the new medication your psychiatrist has prescribed and how it relates to your diagnosis. Although your psychiatrist is the main person of contact related to specific questions and concerns related to your medication, I can help clarify general connections between your diagnosis and the medication, and we can proceed from there if that's all right with you. All right, so your psychiatrist has prescribed for you to begin taking 10 milligrams daily of Prozac, which is otherwise known as fluoxetine. This is an antidepressant and is in a class of drugs known as selective serotonin reuptake inhibitors, which I know is a handful to say, so the acronym is also known as SSRIs. So these medications work by increasing the amount of serotonin in the brain. And to provide some clarification for you, serotonin is a neurotransmitter that sends signals between nerve cells in the brain. Serotonin plays an important role in helping regulate mood. So low levels of serotonin in the brain have shown to be associated with depression. So this medication was prescribed in order to help even out this imbalance. As I mentioned earlier, Prozac is an SSRI, which will block the absorption of serotonin, helping to keep more of it available for use in the brain. Do you have any questions about that process at all? No? All right, that was pretty clear. All right, so what about any other questions that you have? Sure, I can clarify some of the general side effects related to this medication. Typically, some common side effects of SSRIs include dry mouth, nausea, insomnia, headaches, nervousness or jitters, weight gain, diarrhea, sweating, and sexual dysfunction. Unfortunately, I must also tell you that there is a higher risk of suicide when taking this medication, so it's important that you have conversations with your doctor immediately if you have any unusual changes in behavior or mood while on Prozac, and any of these changes can include thoughts about suicide or dying or suicide attempts, new or worsening depression or anxiety, feeling very agitated or restless, panic attacks, difficulty sleeping, new or worse irritability, being aggressive, angry, or violent, acting on dangerous impulses, also extreme increase in activity and your talking as well, and a decreased need for sleep. It's also important that you may not begin to feel the full effects of the medication for about 4 to 6 weeks after beginning this treatment, so don't be discouraged if you don't feel better immediately. Please stick to your doctor's orders about the frequency and dosage when taking your medication. If you decide that you want to stop taking it, I must inform you to discuss this with your psychiatrist in order to ensure that a safe plan is made, as there can be some serious side effects related to stopping the medication too abruptly. And the best way to achieve improvements in your treatment is to utilize medication and therapy simultaneously, and this is when I step in. So now that you have a clearer understanding of how your medication intends to improve your brain chemistry, we can proceed to create a treatment plan together so I can best support you in managing your symptoms related to your diagnosis. I look forward to working with you during your stay here.